Today I want to present a topic to you about gross motor skills and fine motor skills. What's the difference between the two of them? What are some observable examples? What are some activities and how teachers can facilitate the um, acquisition of these skills, as well as some interventions that physical therapy services can take for improving these motor skills in the classroom. So to get started, I just want to define the difference between what a gross motor skill is and what a fine motor skill is. A gross motor skill is one that involves the larger muscle groups, your arms, your legs. They're generally more noticeable, more prevalent, and then fine motor skills have to do with the smaller muscle groups, your fingers, your wrists, your ankles, your neck, sort of various things like that. And although they're noticeable, it's not as prevalent. You'll see a child running versus seeing a child count to five. Um, so, just as a very basic definition, gross motor skills, again, more prevalent. Fine motor skills, still prevalent, they're still noticeable for sure, but the fine motor skills are with like smaller groups. I keep using my fingers as an example. So some of the observable examples for gross motor skills would be, as stated previously, running, hopping, jumping. Let's see what else. Maybe balancing when you see kids playing on a playground, or climbing. Some playgrounds have little rock walls. That's an example of children using gross motor skills. Also, gross motor skills are seen in babies, infants. So, with the first 16 months of an infant's life, the biggest gross motor skills that are being developed and worked on are things such as the infant rolling over, sitting up, crawling, and then moving on to walking. And then I did just say with children, and then some examples that we could see are for a gross motor skill, there's that teachers can intervene in. The gross motor skills are like maybe when out on recess, having the children pedal on a trike, or during reading hour, maybe like taking turns with turning the pages in a book. One day we have a designated helper. Uh, Another would be to jump or hop, maybe when they're outside, throw and catch. Uh, and then for fine motor skills, which is really important, especially in the toddler years, coloring, cutting shapes, Play-Doh, um, anything like that to encourage the fine motor skills. There are various things that if there is a child experiencing any kind of obstacle or issue with the motor skills, whether they're gross motor skills or fine motor skills, physical therapy can intervene. Uh, there are stress balls, there's grip clamps, there's reposturing, another indicator that your child or that a child may need some sort of physical therapy intervention is when children sit right around the time when they're learning to crawl and walk. They have like a W, like they make a W out of their legs. When they do that, that is kind of a sign that they may need help with some gross motor skills and the development of that. With that being said, physical therapy can intervene and really help with reposturing and slowly correcting the behavior. And then to conclude, I would like to say with gross motor skills and fine motor skills, they develop and graduate each step as the age. So just to reiterate, Gross motor skills are include large muscle groups, your arms, your legs, and then fine motor skills are more the smaller muscle groups, your neck, your wrist, your fingers, and then you can see them in babies. And babies are only capable of certain things. Then you move into toddlers, and it graduates up. So as a child gets older, more fine and gross motor skills are being developed and improved upon. And that is what I really have to say about that. So if you have any questions, please feel free to comment below. Thank you so much. Bye.